DPV Health acknowledges the Kulin Nations as First Peoples and Aboriginal traditional owners and custodians of the lands and waters where this podcast has been recorded. We pay our respects to elders past and present and anyone joining us today.
Welcome to the Escape the Vape podcast series created and produced by DPV Health. Young people deserve a healthy life where they can grow, learn and thrive. This sets a strong foundation for the rest of their lives. But the tobacco and vaping industry are threatening the health and well-being of young people through their addictive, harmful products. They have created non-therapeutic vapes with the intent of hooking a new generation on nicotine. To address this, DPV Health have created the Escape the Vape podcast series to educate adults in the community on the various harms associated with vaping and how to support the young people in their lives. DPV Health is one of Victoria's largest independent, not-for-profit community health organisations, providing an extensive range of health and wellbeing services in the cities of Hume, Whittlesea, Mitchellshire, Banyule and Darebin. Our purpose is to support you to live a happy and healthy life through the provision of inclusive, locally based health and wellbeing services. My name is Rebecca and I work in the health promotion team at DPV Health. I'm looking forward to hosting this podcast series and having meaningful conversations with our wonderful guest speakers. On today's episode, we'll provide an overview of what vapes are, why they were created, and the health impacts. We are joined by Dr. Farhan Ulhaq, who is a GP and medical director at DPV Health. Dr. Farhan completed a Bachelor of Medicine and Bachelor of Surgery in 1999 and obtained his postgraduate GP qualification in 2011. Dr. Farhan arrived in Australia in 2017 before joining DPV Health as a GP in 2019. Thanks so much for joining us, Dr. Farhan.
Thank you very much, Becca. It's an honor to be here and speaking about this quite significant topic of the harmful effects of vaping in our community, especially when we talk about our young generation. As you mentioned, that fortunately because of this a hype created by the social media and then a young generation, young adults are hooked towards going towards vaping, thinking that it's a very cool product. But unfortunately, we're going to discuss that in detail, the impact of vaping in their lives. Not only currently, because we're still learning about vaping. We don't know the harmful effects of vaping yet, because cigarettes, of course, we know. Now, what are the harmful effects of cigarettes? But vaping, still, we're learning about vaping and the harmful effects. So, as a doctor, I'm worried. What if some people starts vaping at this age? I mean, about 10 years, it is going to harm them, unfortunately. Whatever research we have got at the moment has shown that vaping contains very harmful products. Of course, I'm going to talk in detail and we'll discuss what we can do about it, what a doctor can provide help and support to young people as well as people who've been smoking and would like vaping to be used as what we call nicotine replacement therapy. But they need to consult a medical professional. A pharmacist can help as well, of course. The correct way to quit smoking, not go towards vaping, not buy these products on the websites and off the shelf.
Yeah, definitely. We're so lucky to have you on board as an expert in your field, Dr. Farhan. So to really get it started, what actually are vapes?
So the vapes are small, they're small devices that are battery operated. So in that device, you've got this chemical or a liquid called e-liquid. And this, what happens that this battery heats up this liquid, which forms an aerosol. And that's what we inhale in the form of vapors.
Yeah, so it's not actually water vapor, it is an aerosol.
It's an aerosol. So it's a battery operated, so it's a sort of a chemical reaction that's formed. So because of this battery, so it's a chemical reaction which warms up this liquid and it forms vapors, and that's what we inhale.
Yeah, okay. And I've heard people talk about reusable or disposable vapes. Are those the two main types?
Yeah, that's correct. Yeah, so there you can, again, if you do a little bit of Googling, you can see a lot of products that's available. They're reusable. Some you can just, you can still use the device, but you can change the liquid. Depends on it. Comes in different flavors as well. A lot of things available now. It's a multi-million-dollar industry at the moment. So different forms available. Yeah, and so easily accessible, unfortunately.
Yeah, too many to keep count of, I suppose, all the different types.
Unfortunately, yeah.
Okay, so when we're going to talk about what actually is in a vape, is that referring to that e-liquid?
That's correct, yeah. So, again, when you asked me to come and talk about it, I did a little bit of research about that, and I was shocked to find what's actually they're using to constitute this liquid. Very, very alarming. What I found, they've got things like red poison in it. So nobody wants to inhale red poison. And some chemicals which we use in lithium batteries, they're using this one, car exhaust fumes, bleach. We use bleach for cleaning our toilets. And they're using bleach for that. And lots of poisons, weed poisons, nail polish remover, paint stripper. The other thing I was saying, they also have formaldehyde. Formaldehyde is a chemical we use to preserve dead bodies.
Yeah.
So that's yucky. So that's the problem.
Yeah, so I guess a question I have is if there's so many toxic chemicals in vapes, doesn't it taste bad or make the mouth feel really, I don't know, like damaged or something like that?
Well, this is the game here. So what they're doing there, they of course they're mixing all these horrible chemicals. But they're also adding some chemicals to hide the bad taste of these substances. So and they also sometimes uses menthol. So menthol is a liquid which when you're inhaling it has got this cooling effect. So it maybe tastes nicer. I've never vaped myself, so I don't know whether it tastes nicer or it cools, but it feels this cooling effect of that as well. So again, they're hiding these nasty chemicals by adding some other chemicals. So young people, they don't know the harmful effects, what's in there.
Yeah.
But that's what the research so far we have discovered. These chemicals are being added, unfortunately.
Yeah, so they're masking them, I suppose, to sort of hide the bad impacts.
That's correct, yeah.
What about nicotine? I feel like that's a really big thing that people refer to when they're talking about vapes.
Yeah, although they are not labeling it that it contains nicotine, but again, I've done my research and they mentioned that there is trace of nicotine even added to these chemicals and the e-liquid. So again, young people, if they're inhaling this or vaping this nicotine, in the long run, they're going to get addicted with nicotine.
Yeah. Okay, so for a lot of vapes, and we're talking about illegal vapes here, the non-therapeutic kinds, they're labeled as nicotine-free when most of the time they actually do contain nicotine.
Unfortunately, that's been the case so far. They have found that they have got traces of nicotine even, although they're not labeling it. So they're hiding nicotine and encouraging young people to vape, saying that it's nicotine-free, but actually it's not.
Yeah, okay, so that is super concerning. So now that we've learnt a little bit about these really nasty chemicals and the nicotine that are in vapes, what are some of the health impacts on the different sort of systems in the body of vaping?
Yeah, just like we know about cigarettes. Cigarettes has got nicotine and tar, which is harmful to the body. I normally, whenever I speak to my patients who are smoking, I tell them that nicotine and tar affects your body from head to toe. Yeah. Anything right from head, for instance, we got the brain. So in fact, it can affect the brain development. People are at risk of stroke, for instance, if they're smoking. It can affect heart attacks. And as we all know, if you're diabetic, you can cause gangrene so head to toe. Just like, and again, we're still learning about vapes. Vapes, so far, what we know, it can, theoretically speaking, can cause problem with brain development. Yeah. Especially in young, kids are still growing. They got this in the phase of growing, so they've got developing bones and developing, so it can affect their growth in general and their IQ levels, and because they're still studying in colleges and school. So in the long run, is going to affect them, unfortunately.
Yeah, sorry, but while we're talking about the brain, does that have any impacts on mental health as well?
Of course, just like we know about cigarettes. Again, I keep on referring back to cigarettes because, again, I'm saying that it might contain a little bit of nicotine as well. It can affect mental health in the wrong. People think that, cigarettes relaxes me, people say, but unfortunately it doesn't. It can cause the opposite effect. It can increase your depression. If you're suffering from depression, you keep on smoking and it's got a sort of vicious circle in there. So it can increase your depression. It can increase anxiety levels. So in the long end, it doesn't help you. It doesn't help you at all.
Yeah, okay. I feel like a really popular one that people talk about is the lungs or mouth and the respiratory system. What are some of the health impacts of that?
Yeah, so again, because when we inhaling these chemicals, we mentioned about, all those harmful chemicals, it goes into the lung from the upper respiratory tract. So it can affect the throat, it can cause throat irritation, cause sore throats and other issues. In the long run, it can affect the lungs as well because it's all going inside the lungs as well. So again, we are still studying about, as we know, cigarette smoking can cause lung cancer. Maybe in 10 years, it would be proven that even vaping can cause some sort of lung malignancy or cancers and stuff as well. So in the long run, if you're asthmatic, for instance, if you're smoking, it's not going to give, your asthma control will get worse, unfortunately. People who come in and you're asthmatic and smoking, I'll tell them, ultimately develop a condition called COPD, so in which the inhaler stop working. Same for the vapors as well. If you got asthma, especially I'm talking to the young people, if you've got asthma, if you're vaping, your asthma is gonna get worse. And it will affect your sports. If you're a sportsman playing sports, your exercise tolerance will eventually decrease. It will affect your performance in sports, in academics. So it's no-brainer. It's not good for you.
Yeah, okay. And then what about sort of the stomach? I've heard that sometimes people can have nausea or even vomiting.
Yeah, unfortunately, as I mentioned to you, again, it's a toxic chemical in the liquid. If you, for instance, if you can inhale it, or inhaling, of course, it's a problem if you can ingest it. It can cause poisoning. If it goes in your stomach, because it's so toxic, with all the, think about these rat poison, I'm thinking about rat poison, it can cause nausea and vomiting. It can cause irritation in the stomach because it's so toxic. It can cause problem as well. In the long run, again, as I said, we are still studying about these harmful chemicals. Thinking about bleach, having a bleach inside your stomach, what's going to do to your stomach? It's going to cause stomach ulcers.
Yeah.
That's horrible.
Yeah, really, really bad health impacts there. Do you know of any other health or safety risks that the listeners should be aware of?
Yeah, again, because these devices are battery operated, so I have heard horrible stories. These batteries have exploded inside the pocket, and so if you're in the upper pocket, it can cause serious burns. And if it is in your lower pocket, you're wearing your jeans, and then it can cause serious burns to the skin. So again, it's not very nice.
Yeah, and when we're talking about the batteries, I've seen some information online about there being fires in landfill. Do you know anything about that?
Again, it's very difficult to dispose them of. Again, just like for usual day-to-day use batteries, we can't put them in our dustbins.
Yeah.
Can we? We can't. So we have to go to Bunnings to dispose them off in that safety, in a safe manner. Saying again, any battery devices have to be properly disposed of. And right now, I don't think people are putting them correctly to be disposed of. So we're putting them in their domestic bins. When they go into the landfill, of course, it's a fire hazard.
All right. So now that we've got a bit of a background on what actually is a vape and some of the health impacts, can you tell us a little bit about the origin of vape? So where did this come from?
Yeah. So again, I have done a little bit of research. Going back to vaping, we're going to thousands of years. Apparently, Greeks and Egyptians used to create this form of vapes just for leisure purposes, enjoyment purposes. But actually, vape was just doing some research. First, the vape was invented in China in 2003. That's the first time an electronic cigarette was invented by this gentleman called Ulhaq. Unfortunately, I won't say gentleman. I don't think it's a very good invention, unfortunately. And now it's all over the world. So the problem with that, again, going back, cigarette smoking, Second World War, whenever you watch Second World War movies, everybody's smoking also, just smoking. Because it was a sort of a trend at that time. Everybody has to smoke that time. But at that time, nobody knew the harmful effects of smoking. We knew about harmful effects of smoking in around 60s.
Yeah.
It can cause lung cancers and lots of other issues as well. So now, and then people say, please don't smoke. And then people start looking for, what are the alternative way to quit smoking, stuff like that. So it's all come into play at that time.
Yeah, okay. So the creation of the modern vape, sort of as we know it now, which was made in about 2003, it was made as a response to people trying to quit smoking.
just an attempt to do that. But again, that's not, I would say, a wonderful replacement. It has to be a better solution.
Yeah, okay. So we know that really, I suppose, 2016, 2017 onwards,
Yeah.
vapes became really successful.
Yeah.
Do you know why that sort of came about?
Yeah, again, because of restriction now, you can't smoke. When you initially there was no restriction, but now there are a lot of. If you go to train station or you're in an office, you're not allowed to smoke. So the people found and cigarettes you have to have a lighter to light it and smoke. But now people just put that vape in your pocket and easy whenever they can just have a little vape here and there. So they found it easy to switch from cigarettes to vaping. They found it easier. So I think that could be I would say a trend to switch from cigarettes to vaping. And now, but again, as I said, it's not a wonderful replacement. It's because of easy and convenience, I would say.
Yeah.
People have invented that.
Okay, so then if vapes why aren't vapes very effective in helping people quit? And then what are the, I guess, better or more approved ways to quit smoking cigarettes?
Yeah, again, if vaping is not the best of if you're smoking and if you think I would like to quit smoking and I'm going to start vaping, this is not the best solution. The best solution is to go and speak to your doctor, or you go to and speak with your pharmacist. That because it has to be an approved way, and which is medically proven and researched. So we have got a lot of options available which are approved by what we call TGA. This is it's a governing body we have got called Therapeutic Goods Administration. And what your pharmacist can help you and guide you, because there's certain products available. You can easily get it over the counter. You don't need a script for that. So we've got the nicotine replacement therapy in the form of gums, in the form of sprays, and the form of patches. So these are all approved and fairly safe to have instead of going towards vaping.
And just quickly, have those sort of safe examples that you were talking about, have they gone through the rigorous testing and things like that?
Of course, yeah, because TGA won't approve it otherwise.
Yeah.
So TGA is, as I said, is a governing body. Any new medication that comes into practice, which we are allowed to prescribe, TGA normally, they have got this own process to test whether the safety of that medication. Same goes for these nicotine replacement therapies. So it's all proven and tested.
Yeah. Okay. So what happens then if someone comes to a doctor to try to quit smoking? So then you would prescribe or direct them to grab one of those products.
Yeah.
If those, and we know that with quitting cigarettes, it can take a few attempts before they are successful.
Yeah.
What happens if they have gone through these products and they're still not able to quit?
Yeah, so first of all, as I said, let's go through the options for what we can do as a general practitioner. So people come in, of course, it's a very, very common thing. People come and see me. First, we need to assess how many cigarettes they've been smoking for how many years. So what stage of quitting they are at the moment, what have they tried so far. So if somebody who hasn't tried anything, smoking 20 cigarettes a day for the last 10 years, for instance, so I'll give them options. So we've got options, for instance, start with the patch, nicotine patch. So nicotine patches, normally we prescribe, we need to put that first thing in the morning, and that works at 12 hours. So put that first thing in the morning and take it out at nighttime. And during the daytime, they can have options of having a nicotine gum or a spray for any cravings they've got. So that's proven to be very effective in most cases. If that doesn't work, then we got the options to give them certain medication. The certain medication, a popular one is something called something called Champix. So Champix is also used as a form of cigarette smoking cessation therapy. The other option I can think of is something called Zyban. So these are all a few medications I have prescribed in the past with I think fairly good success rate, but a lot depends on the person itself. You can prescribe anything, but if the patient is not ready to quit, nothing's going to work. So they have to decide that, yes, this is the time for me to quit smoking now. I'm going to speak to my doctor, and this is the plan. So normally, I have to sit with the patient, make a plan. In the next 3 months or next 6 months, we need to go from 20 to 0. And then we plan. We discuss with the patient. It's more of I would say, a patient-centered approach in quit smoking. So that's the options we can do.
Yeah, okay. So then we know that those are the most successful and approved ways to quit.
Yeah.
What happens if that isn't working? Can the patient then access a vape?
Yes, they can. And now we have got the only prescribed vape as well, which is nicotine, which is, again, these are the ones who are under prescription. So a doctor can prescribe that, which is nicotine only, and these are not the ones you can buy from a website. Yeah. So these are not containing the harmful chemicals and stuff like that. So these are all pure nicotine based. Depends on different strength as well. It comes in different strength as well. So these are prescribed vapes. So these are the proper way. These are TGA approved as well.
Okay, and then what happens if a patient comes to their GP or pharmacist and they're actually looking to quit vaping? Are there any sort of supports that you can provide?
Yes, in order to, again, if they want to quit vaping, got other options. I think the most important, again, as I said, they have to be willing to quit. That's very important. And then we can give them some sort of support in terms of referring them to a psychologist. Psychologists can help as well, something called CBT. They can use this method to quit vaping. But they need to have a strong will in order to do that. Because if you don't have a strong will, it would be difficult for others to help you. So in order to help others, you have to help yourself.
Yeah, okay. And so a big question I have is, what is the difference between a young person who has never smoked using non-therapeutic or illegal vapes compared to a smoker who is trying to quit and they're using vapes that way?
Yeah, so as we discussed earlier, some of these chemicals have got a trace of nicotine in it. So if a young person starts vaping, who was never exposed to nicotine in the past, unfortunately, there's a chance that if they continue to vape, they will addicted to nicotine. So the chances of whatever research we have done so far about these vaping, that if somebody, young people, started vaping, the chances that most likely in the future they will start smoking as well. So risk of them getting addicted to smoking cigarettes would be higher. But somebody who's smoking all their lives and they would like to switch to vaping in order to quit smoking, that of course, as I said, it has to be guided by a medical professional who's expert, who can prescribe the right product of the right strength and able to monitor that. So that's very, very important to consider. I would say this is the duty of the parents to speak to their kids about the harmful effects of vaping. So if they start vaping, they put them at risk of start smoking in the future. And nobody wants the kids to develop this nasty habit of smoking.
Yeah, definitely. So I guess a final question I have for you, Dr. Farhan, is what advice might you have for someone who's looking to quit vaping or smoking?
Yeah, so again, I said, speak to your doctor, speak to your pharmacist, speak to them about the options they've got at the moment, and we can guide them accordingly. A lot of options available guided by our regulating body called TGA. We got the products available like nicotine patches, nicotine gums, as we discussed earlier, and we have got also the prescribed nicotine vapes. So of different strengths, again, the doctor has to assess which strength you would need, and the doctor has to regularly monitor your progress accordingly and guide you through this journey.
Awesome. Thank you so much, Dr. Farhan, for sharing your expertise on how vaping can negatively impact our health, as well as sharing your valuable suggestions for those in the community seeking support to quit.
Thank you very much for having me, and it's a nice talking to you.
Thank you for listening to this episode of the Escape the Vape podcast series. In the next episode, we will be joined by Alicia Brooks, Chair of the Federal Tobacco Committee, and Rachel Anderson, Director of QUIT. We'll discuss the unethical marketing tactics of the tobacco and vaping industry and go through the new laws set by the Australian government to help protect young people. If you are looking for more information on the harms associated with vaping, visit the DPV Health website at dpvhealth.org.au/escape-the-vape/. The link is also in the description. The website has a host of resources for young people, parents, educators, and the wider community, as well as links to support services. If you are looking for any support with your quitting journey, QUIT is here to help. Call 13 78 48 to speak with a friendly Quitline counsellor.